Hello, welcome to Library Connection. I'm Mandy Cantrell, Youth Services Director at the B.B. Comer Memorial Library. I want to thank TV47 and Chris and Robert and all the people who helped make our program possible. Today, Jeff Wood, the infection preventionist for Coosa Valley Medical Center, is joining me again. And I know it hasn't been very long since you were on before, but COVID is still on our minds and still a very hot topic. So thank you for joining me today.
My pleasure,
Jeff.
my pleasure.
Well, the one question we all want to know is COVID on the decline at the present time?
Well, so far this week, well, this is a Monday, so
right, yeah.
let me back up. Let's say for the next last 7 days, we've only had 2 positive cases that came through our emergency department. So it is a sigh of relief that we are seeing a little bit of respite from this pandemic.
Yeah, I'm so glad. And I know that is just the people you see. That doesn't count other physicians' offices.
That's correct. Like those are people that are coming through the emergency department. Okay. And one thing that we're seeing as well is the number of cases that we're testing is going down as well.
Oh, that's good.
Yeah.
That's
so
good.
So we are really we're really fortunate to kind of, what we see is the downside, and we hope it continues to go that way. We only have 1 patient that is in the hospital right now.
Oh, that's good.
Which is very good. So we are very thankful for that.
Well, I should say this many times, but thank y'all very much. All the hard work, all our healthcare workers, nurses, doctors, CNAs, everybody, hospital staff, and any kind of medical personnel.
They have done a fabulous job. Let's talk about the people at the bedside. That's the real people that are doing the work out there. Your emergency room staff, they weathered this with just such grace and such perseverance that it's just incredible.
Right.
Our respiratory therapy department.
Oh, yeah.
Those people, respiratory is one of those departments that are right there at the bedside. They're giving breathing treatments. They are all in the person's face, so they've done an incredible job of staying safe and providing care for those COVID patients. So.
I know they've had to work under, I want to say terrible conditions, not by the hospital, but just with staff being out, having to quarantine and all that. So we do appreciate everything. Please pass that along to your staff. Okay, and I have enjoyed seeing the updates from CVMC on the Facebook page. So when you said only 1 person in the hospital, it's been as high as 20. That's a bad question to ask you, but it's been very high.
I know when the Delta variant hit, there was a really bad day at the hospital. Right. We strive, if you come into our hospital, we want you to get to the most appropriate care possible.
Yes.
And that a lot of times is coming out of the emergency department and into a patient room as quick as you can. And then this one particular day, we had several patients that were in the emergency room. And, this was a bad day, but it was a great day as well because the team just came together and we did everything we could. And we eventually got all of those patients out of the emergency department into a patient bed, which was phenomenal.
Yes.
It was good teamwork.
A lot of work. So
yes, ma'am.
That's great. Well, you mentioned the variant. What is a COVID variant?
So the COVID virus, when you look at it, you see the different proteins. So if you see a picture of it, you got the blue ball, and then there's like red spikes on it. So that variant changes out some of those proteins, and that allows the virus to mutate and to kind of camouflage itself from the body's response systems. And that's not uncommon for viruses to do that. In fact, that's very common. This was not a surprise that the COVID was going to mutate. We kind of figured that it was at one point in time, so it wasn't a surprise at all.
Is it almost like flu? It's flu A or flu B, or flu this year is different from last year?
That's correct. That's correct. And same thing with flu. It changes out those proteins. That's why each year you get a flu vaccine, because based on the information from the previous year, that's what scientists decide to immunize against for the coming year, if that makes sense.
Right.
So.
A lot of work behind their best guess, but a lot of work behind that
Absolutely.
to make a very good guess, educated guess. Well, are you seeing some of the original COVID, or was it mostly the variant?
Well,
Delta variant.
So when the Delta variant started coming, we sent off testing to identify it as Delta. And then once we got to 100%, we quit doing that. So we have quit testing whether or not it's original COVID-19 or some type of variant. And what we have seen throughout the entire pandemic is as things go across the nation, they come into South Talladega County and then into Sylacauga. And so we'll be watching that from a national perspective if there's any kind of new variants. And if there is a new variant, then we'll put into place our testing for that variant.
Okay. But the treatment for it is the same. Somewhat. It's the infusion?
Yes. So we have the infusion available, and the way that you get scheduled for that is you would go see your primary care physician. They would test you for COVID. If you become positive, then they will send you to the hospital and you'll get an infusion. The infusion lasts about an hour, and then we keep you another hour to make sure you're going to be okay, that you're not going to have any kind of allergic reaction. And what the infusion does, it kicks your immune system into overdrive. So it helps your body start producing the antibodies that are going to fight the virus. So we've seen really good results from that. Unfortunately, there are some people that get really sick afterwards. But again, that's your body's system of fighting the virus. So that's to be expected as well.
All right. Well, we're going to pause for a commercial break, and we'll be right back and talk some more with Jeff Wood.
Since 1848, First Bank of Alabama has been dedicated to our customers and excellence in all areas. With constant improvements to our facilities, to adding new products and services to better serve you, our team is fully engaged in all the communities we serve. First Bank of Alabama knows that time is money, so we offer hometown services with advanced technology that allows you to bank on your own schedule. We want to be your community bank, so stop by. Come see us at First Bank of Alabama, where you're always first.
Marble City Pharmacy in Sylacauga is your destination for the highest quality health care. Our knowledgeable pharmacists are always available for questions about your medications or advice on taking over-the-counter products and supplements. Our friendly staff can assist you in choosing from our full lines of compression hose and medical equipment. And don't forget our gift department. We have a great selection of unique gifts for every occasion. Stop by and see us today. Marble City Pharmacy, here for life.
Coosa Valley Medical Center, one of the top 10 hospitals in Alabama, is also Sylacauga's largest employer. Services from the emergency room to surgery to cancer treatment to post-stroke care. You won't believe what's right in your backyard. It's Coosa Valley Medical Center in Sylacauga. So, if you're sick in Alabama, choose one of the top 10 hospitals in Alabama. That is Coosa Valley Medical Center.
Hello, welcome back to Library Connection. I'm talking with Jeff Wood, the infection preventionist at Coosa Valley Medical Center. We're talking about, of course, what everybody else is talking about, COVID, but so very proud of the way y'all have jumped on this and made it just made it easier. I think helped a lot of people. So I don't even know how to put that into words, what y'all have done. I can't imagine the work. But we were talking about the infusions, and that is wonderful. And y'all give those a lot, I guess, as soon as someone comes in and can take it. But I hope I never have to have an infusion because I don't want to have COVID. So talk about the vaccines. Are they still being given?
Yes, ma'am. So on Wednesdays in our lobby at Coosa Valley Medical Center, we are providing the Pfizer vaccine, and we are providing your first dose, your second dose, and your booster dose. So you're still eligible if you have not received your first vaccine. I would encourage you to come and get it, even though our cases, yes, they're going down. But in order to get this thing totally out of Sylacauga, need more people vaccinated. So you can still come get your first dose. After your first dose, in 3 weeks, you'll be scheduled for a second dose. And again, those are done on Wednesdays. Wednesdays is your day to get vaccinated.
Okay.
Usually it's from 8:30 to about 11:30. Encourage you to look at our social media pages, our Facebook, to look at the times that we're going to have, because sometimes it varies. Now that we're out of the pandemic, we
Right.
do a little bit different, but for the most part, it's 8:30 to 11:30. And so you can get your first dose, and then 3 weeks later, you'll come in and get your second dose. And the process is, from what I hear from giving the vaccines, most people are very pleased with the process. The longest wait time is after you get the injection. We ask you to wait either 15 minutes or 30 minutes just to make sure that you're not going to have a reaction. We want you safe. And so we ask that you hang around for that period of time. So that's the greatest amount of time usually for the wait. And then for the booster, for the third dose, it's the same process. You just come in and you tell the registration people that you're here for your booster dose, and we get you on back. And it's the same dose. It's the Pfizer vaccine, same amount of vaccine, and same waiting time.
Just a booster to get us
Just the
through
booster.
a little bit longer.
Yes, ma'am.
Right.
So you're eligible for the booster 6 months after your second dose.
Okay, good.
That's where the cutoff. And who's eligible for the booster? So people that are 65 and older are eligible for the booster. 18 to 65 for those people that are working in high-risk areas such as healthcare, retail, around the public, those sort of people. Teachers, yes, exactly. So it's almost like, if you can remember back where we first said 65 and over, it's along those same timelines that are going on. So
Now, is there a charge for these, for the vaccines or the booster?
there is no charge. Those are, the vaccine and the booster are free, and we deliver that service and
Wonderful.
to our community.
That's great. Well, I've had my first two. I'm waiting to hear when I can take my third. I'm not 65 yet, but I know I'll be ready to take that.
Yeah.
And is it important to go ahead and take the flu vaccine? I know last year flu wasn't, I heard somebody say the flu, wasn't as bad last year, but we all washed our hands and wore masks and stayed apart. So, but flu is
correct.
still here.
Flu is here. It is time to get your flu vaccine. Now, that's something that we're not doing on Wednesdays.
Okay.
You can't come into Coosa Valley and get a flu shot on Wednesdays. But I know several places around town is available. Your pharmacy, your physician's offices. I imagine the health department as well.
Right.
All of those places are areas that you can get the flu vaccine.
Okay. Now, I know you said you're giving the Pfizer booster. Is that the only booster available? One is on the way. And
One
maybe
is on the way, yes.
Moderna?
Moderna and Johnson & Johnson are on the way. And the recommendation now is, if you got the Pfizer vaccine, then you get the Pfizer booster. It's not recommended that you mix the two. So let's say that you got Moderna and you can't find Moderna, then people say, well, I get the Pfizer. Not recommended, but it's not, you can't not do it.
It's not impossible.
It's not impossible, but you do want to try to stay in the same lane that you were working.
Well, that
in.
makes sense.
Yeah,
That makes
yeah.
sense. Perfect sense. I know we talk a lot about who should take the vaccine. I know healthcare workers, teachers, people who work with the public, older people, and I hear the words immunocompromised and underlying medical conditions. Kind of explain what that means.
Okay, so immunocompromised people are usually those people that are receiving some kind of drug or treatment that knocks down their immune system. This would be your chemo patients, your bone marrow transplant patients, any kind of transplant patient where the immune system is kind of, there's treated to back it off. So those are immunocompromised people. Underlying health conditions are those people that have things like diabetes, like heart disease, coronary artery disease, strokes, and what we saw as well is obese people. Those people seem to not do as well for the COVID as other people. Some other underlying conditions: COPD, any problems breathing, asthma, emphysema, all of those diseases would also include underlying conditions.
Okay, well that makes perfect sense. They would be affected by COVID more so than a healthy person. Now, I've had the vaccine, right? But I can still get COVID.
Yes,
that's correct.
Right. That's correct.
No vaccine is 100%.
That's
Nothing
correct.
is 100%.
Yes, that's correct.
Yeah.
So the initial efficacy of the vaccine was around 98%. I think subsequent studies have come out something like 95%. Still very good to get that out there. I'll take a 95% chance versus a COVID chance any day.
Absolutely. Now, when you had people coming in and that were sick enough to have to be admitted to the hospital, did most of them have the vaccine, or they were unvaccinated? Or partially vaccinated?
Yes,
too?
so the majority of people were unvaccinated. Right. The lowest that we got, I believe, was right at 70% of unvaccinated people in the hospital. So 30% of those people were vaccinated. And typically what we saw was the people that were vaccinated were older people. Greater than 75 years of age, actually.
Yes.
I can't recall anybody young that was vaccinated that was admitted to the hospital. So all of them, all the people the majority of the people that were admitted were unvaccinated people. Yes, ma'am.
Okay, well, 70% is good too,
Yeah,
to me.
yeah,
I
that's
think
right.
so.
That's right.
Now, okay, I've had my vaccine 1 and 2. Do I need to continue wearing a mask?
Yes, yeah. It's a good idea. Excuse me. It's a good idea to wear your mask out in public still, and that's just to help. I mean, here we are.
Right.
We're close.
Yes.
We're real close. Let's do everything that we can in this fourth quarter, if you will.
Yeah.
Let's reach deep. Let's
Don't
reach
quit,
deep
yeah.
and don't quit. Let's pull it out and let's finish this whole thing. Let's wear our masks. Let's wash our hands. Let's stay away from crowds. Let's do all this so we can finish strong.
Yes, because I think before we thought COVID, it's going away, and then a big resurgence of the variant, or fewer people wearing their masks.
Yeah, and I don't know. I don't know which one of those it was. I know myself personally, I left the house one day without a mask when it was going down, and Lisa said, "Oh my goodness, the pandemic's over. Jeff Wood is leaving the house without a mask." So,
well,
I don't know, but the Delta variant was more contagious than the original, and so I think you saw it just spreading a lot quicker than the original COVID virus. So.
Okay. Well, we'll pause for another commercial break, and we'll be right back and talk some more with Jeff.
Since 1848, First Bank of Alabama has been dedicated to our customers and excellence in all areas. With constant improvements to our facilities, to adding new products and services to better serve you, our team is fully engaged in all the communities we serve. First Bank of Alabama knows that time is money, so we offer hometown services with advanced technology that allows you to bank on your own schedule. We want to be your community bank, so stop by. Come see us at First Bank of Alabama, where you're always first.
Marble City Pharmacy in Sylacauga is your destination for the highest quality health care. Our knowledgeable pharmacists are always available for questions about your medications or advice on taking over-the-counter products and supplements. Our friendly staff can assist you in choosing from our full lines of compression hose and medical equipment. And don't forget our gift department. We have a great selection of unique gifts for every occasion. Stop by and see us today. Marble City Pharmacy, here for life.
Coosa Valley Medical Center, one of the top 10 hospitals in Alabama, is also Sylacauga's largest employer. Services from the emergency room to surgery to cancer treatment to post-stroke care. You won't believe what's right in your backyard. It's Coosa Valley Medical Center in Sylacauga. So, if you're sick in Alabama, choose one of the top 10 hospitals in Alabama. That is Coosa Valley Medical Center.
Hello, welcome back to Library Connection. I'm talking with Jeff Wood. He's the infection preventionist at Coosa Valley Medical Center. Now, we were just talking about the vaccine and the variant, all of that. Now, if I've had my vaccines, can I still spread COVID to other people?
There is a possibility that you can still spread the COVID, so that's one reason we were talking about masks previously. That's one reason why you want to continue the mask. And let's still remember that this is a novel or new virus, and so we know how coronaviruses work, but we're not sure about this particular COVID virus. So there is a chance that you could get the virus in your nose or your mouth and then still spread it to other persons. So that's why if you're vaccinated, you still need to wear a mask just to protect those that are around you.
I might not feel sick, but I could still maybe pass it.
That's right, because the vaccine, the way the vaccine's working is to help your immune system recognize when that virus is in you. So when that virus is introduced in your body, your immune system says, oh yeah, I remember that, and produces the antibodies that help fight it off. So you still could have the virus in your nose or your mouth.
Wow. Now, I've had the vaccine. If I'm exposed to COVID, I mean, I know there's still a chance I could get it, a slim chance, but there's a chance. How long do I need to quarantine? And I will say, I know the numbers on this have changed so much as you've learned more about it.
That's right. And different places have taken up different I guess, quarantine periods. So we at the hospital, we're considered essential workers, and so unless we are having symptoms, then we come to work. But the ideal quarantine is 10 days if you have it, and then 14 days if you've been exposed to it. So.
Okay. And you might know you have it. I mean, you won't. If I was exposed today, I might not know tomorrow.
That's right. It could take 4 to 7 days before your symptoms come on. So that's what makes it so contagious, is you can have it, not feel sick, and still go about your business. Meanwhile, you're spreading it to other people. Another reason why mask is so important. And we'll say this too about mask: wear the mask properly. I see a lot of people with it over their mouth, but not covering their nose.
Yes.
If you're gonna wear it, let's wear it. Pull it up over our nose, cover our nose and our mouth.
Right.
So.
And there are ways to wear it correctly, but where it's a little more comfortable, I guess.
Yes.
I've learned to tie knots in the side so it doesn't press against my lips, but because I'm going to wear it, so I'm just going to make it as comfortable as I can.
Absolutely.
All right.
Absolutely.
Any advice? I mean, we're about to have Halloween, Thanksgiving, Christmas. Any advice for gathering with families?
Yeah, so gathering with families, first of all, I would say be vaccinated. That's a great opportunity to help stop the spread. The other advice is to continue to spread out as much as possible. Halloween's great because it's outdoors mainly, so that seems to be really effective being outdoors. So you don't seem to spread it as quickly, but indoors with Thanksgiving and Christmas coming up, I would say just be vaccinated, and if you have family members that are unvaccinated, we want to stay those 6 feet, remain that 6 foot social distancing.
Right. No hugging, or not as much hugging as we would like.
That's right.
All right. What about traveling?
So traveling, that's an issue because every airline, every hotel is going to have their own kind of COVID protocols. And so you want to know what those protocols are before you travel. Some airlines even require a certain type of mask. So you want to check with your airline and make sure that you have all the proper things. And some places that require vaccination, you want to make sure that you have your vaccination card so you can show proof of the vaccination status. I know we have a concert that we're going to this week, and they require vaccination status, so I've got everybody's vaccination cards ready to go.
All right. Now, one thing I forgot to ask about the vaccine, what are the ages? I mean, how young can you get a vaccine?
So right now, 12 and up is recommended, okay, for the Pfizer, and Pfizer has just released data from 5 years old on up, so as little as 5, and I don't know if that's CDC approved yet or not, but I know that they released the data. I think that was done Friday or over the weekend. So, this is constantly changing. So, if you need the most up-to-date information, one, I'd say check with my physician, and then two, go to the CDC website. They have a frequently asked questions page, FAQ.
Okay.
And that's a great source to really get all your questions answered.
That's good to know where to go, because a lot of times we just Google it, and I love Google, but you can hear or read a lot of different ideas.
Yeah,
so
that's
the
right.
CDC.
Yes, ma'am. CDC is best.
Great. Well, do you think we will ever be back to normal? I know that's a bad question, or is this our new normal?
That's a great question. I think this may be our new normal. We need to continue to wash our hands. I think that's a great new normal to have. Wash your hands.
And that is the best way to prevent the spread of anything, isn't
absolutely,
it?
absolutely.
So simple. So simple.
It's a hallmark of our infection prevention at Coosa Valley. Let's everyone wash their hands.
And teach your children from a very young age to learn to do that.
Absolutely.
Well, we just thank you. I thank you so much for coming in today. I know y'all are terribly busy at the hospital. And again, I want to say thank you to all the people at Coosa Valley, all the physicians' offices around town, everyone who's had to do with the teachers, parents. Our whole lives have been just kind of turned upside down, but hopefully we are on the way back. But thank you for joining me today. And thank you for joining us on Library Connection.